Hi, everyone. This is Dr. Hanadi Ibrahim, pharmacist and bioanalytical chemist from Vancouver, Canada. Today, I will talk about physical exercise between inactivity, moderate, or intense exercise, and its link to heart health, COVID-19 infection, and vaccine. As we all know, cardiovascular disease is one of the leading causes of death in the global population. We also know that physical fitness and cardiovascular health are closely linked. Actually, data has shown that maintaining or improving fitness is associated with lower cardiovascular disease risk. And conversely, low cardiorespiratory fitness has been linked to increased risk of heart failure and heart failure related death. So it's very important to stay active, to do moderate exercise. However, chronic extreme exercise training and competing in endurance events can lead to heart damage and rhythm disorders, especially if there is some genetic risk factors. And more evidence from epidemiological studies and observations in cohorts of endurance athletes suggest that potentially adverse cardiovascular manifestations may occur following high volume and or high intensity long-term exercise training, which may attenuate the health benefits of a physically active lifestyle. Here, we need to be careful with what we say. Moderate exercise is very important. Many studies showed how it's important to keep active, to stay active. However, here we are talking about this study were done in athletes, and we found that there's more evidence of accelerated coronary artery calcification, also exercise-induced cardiac biomarker release, such as troponin I, in addition to myocardial fibrosis, and even higher risk of sudden cardiac death. And unfortunately, sudden cardiac arrest is one of the leading causes of death in athletes. And now, after the pandemic, we added another risk. Recent studies showed this observation and this phenomenon of COVID-19 associated coagulopathy, which is a life-threatening complication of this infection. And it involves this kind of coagulopathy. It involves a complex interaction between the innate immune response, the coagulation and fibrinolytic pathways, and the vascular endothelium. All of that resulting in procoagulant condition, especially for people who have severe infection. And if they are, these athletes, some studies done in competitive athletes, some of them, they have some subclinical myocarditis. So we add to this risk the period of the rollout of COVID-19 vaccines. Recent studies show some increased emergency cardiovascular events among under 40 population in Israel, and there is recent study in Thailand in adolescents. Here, I am here not to talk about, it's very challenging to assess the connection between myocarditis and other potential cardiovascular condition and COVID-19 infection and vaccine. But we need to be concerned somehow about these myocarditis in a way that previous studies, and they were really very important studies, demonstrate that myocarditis is a major cause of sudden unexpected death in adults less than 40 years old. At the same time, there is many studies found evidence that high intensity exercise can actually increase the risk for sudden cardiac arrest or sudden cardiac death in individuals with underlying cardiac disease. So all of that with anecdotal evidence we have learned about, I would like to conclude by saying we need to continue monitoring and raise awareness. We need to follow up to obtain medical records, conduct case reviews. Also, we need to have surveillance reviews focusing on myocarditis and pericarditis. Especially, we need to characterize clinical features such as shortness of breath, chest pain, or even some kind of palpitation, heart palpitation. But most importantly, is we need to test some biomarkers, as I mentioned, troponin I, or here in case of heart damage, maybe D-dimer. All of that in order to follow up to reduce the risk for adverse cardiovascular outcomes. And I would like to conclude by saying, even surrounding you, people who got severe disease of COVID-19 or got the vaccine, they need to listen to their body. If some of them, they do intense physical exercise, they need to pay attention to some symptoms, shortness of breath. They need to stop if they have any severe symptoms and follow up with their doctors. Thank you so much for your attention.